Hello, everyone. This is Alraies from SCAI 2022 with me, Dr. Karim AlAzizi. He is from Baylor Scott and White. Dr. AlAzizi, thanks for being with us.
Thank you, first of all, for having me. It is really exciting to see everyone in person. I had the pleasure to present the DIPRA trial, which is essentially the distal radial versus proximal radial for cardiac catheterization. This is the 30-day data and first look at it where we randomized patients between these two cohorts, 150 patients in each arm, with the primary outcome as a composite that looks carefully at hand function. We have seen numerous data, including our own, with several meta-analyses that has already been published over the years since the emergence of this axis, on radial artery occlusion rates being lower with distal radial. And we've seen within the last couple of days also the emergence of the DISCO trial being presented at EuroPCR, highlighting the lower radial artery occlusion rates with distal. But there has always been the question about the hand function and the proximity of that artery next to the nerve in a very confined space in the anatomical snuff box. So we aim to assess the hand function through three different things, multiple angles. One is a quick DASH questionnaire. It's a questionnaire meant to assess a patient's function through simple 10-11 questions that are measured at baseline and at 30 days as well as 1 year. A hand grip test as well as a pinch test. So to assess really the motor function of the hand, again at baseline, and then we compare it to 30 days and 1 year.
I want to just stop here for a second. What made you pick these three tests? Did you consult with a physical therapist or somebody recommend these tests?
Good question. Yes. So these tests and the questionnaire actually are used in the occupational therapy. We know that hand grip is widely used even in assessment of frailty when it comes to several procedures, and have been linked to see really a good reflection of the motor skill of the hand. So with the idea of what other things other than a questionnaire, but more of a measurable instrument that perhaps can give you an idea if the motor function can be affected, we chose these two tests. Now, especially when we're talking radial interventions and radial procedures, a lot of patients may come in with jobs that require fine dexterity and movements and utilize or rely on their hand for their living. So it was an important question, both in the proximal as well as in the distal, although our highlight was mainly comparing the distal to the proximal radial.
Correct. So you presented the 30 days, but you're going to plan to follow up this patient for a year.
Correct.
Yep.
Correct. Yes, we're planning to follow these patients for a year and hopefully present the 1 year outcomes next year. But so far, it is reassuring, and the signal is definitely there that distal radial, as compared to proximal radial, is safe.
So a safe bleeding, transfusion, hematoma, compartment syndrome, obviously this is the standard vascular complication, is the same as well.
Yes, so when we looked at our, these were listed as part of the secondary outcomes. We looked at the hematoma, we looked at the bleeding from the site. Thankfully, none in the distal radial cohort, just a couple in the proximal radial, although didn't reach statistical significance. More importantly, also, we've shown a signal that was similar to the other studies, which is the radial artery occlusion rates at 30 days. Again, very similar statistically, but none in the distal radial and a couple in the proximal radial.
So, Karim, you are an expert in getting the access. So for people who are not expert in distal access radial, you are savvy, you're an expert, you know how to get it done. Is it also going to be safe in people just beginning to do it?
You know, great question, Shadi. I think there is a learning curve, but the learning curve can be really, flattened out by two key things that we've shown in our study. And it wasn't just me that was doing this procedure, but also my co-investigators. And not everybody was doing distal radial as part of their routine practice. So two things. One is careful patient selection. Palpable distal radial artery, visible on a good ultrasound, you're probably going to be very successful, and that flattens the curve. And so if you look at the study, we mandated ultrasound guidance for the distal radial and optional for proximal radial, since it's very common and routine and doesn't really require that. So if you didn't feel a distal radial, then your curve is very high and you may not get it. So the question is, it's not really different than a proximal radial, apart from perhaps from our study, from our experience with other operators that perhaps don't do it routinely, ultrasound guidance helps quite a bit.
Absolutely. Well, this is definitely interesting findings and definitely close a big gap about the differences and the discouragement from operators to use distal radial versus proximal radial. Dr. Azizi, thank you so much for your time and congratulations for late breakers. Please watch these videos and others on the SCAI-TV. This is Alraies from Detroit Medical Center. Thank you.
Thank you for having me, Shadi. Appreciate it.